Hello friends, welcome back. Let's continue our study of mind rubrics, and the rubric that we are going to study today is abrupt. So what is the word meaning of abrupt? Abrupt means sudden and unexpected. A sudden and unexpected action, word, attitude of the patient. Or it also means that the patient lacks in smoothness in his actions, or there is no continuity in his actions. Suddenly, without any reason, without any warning, the patient changes his actions. Okay, involving action or change without preparing or warning. No warning. Suddenly you change. Suddenly you start behaving differently. So it is like abrupt means rupture. Abrupt comes from rupture. Ab is sudden, you suddenly end, you rupture or you break a thing suddenly. In between, there is one continuous thing going on and you rupture it or you break it in between. And without reason, it is unreasonable, unexpected. You don't understand why this is happening. So it is like, I am talking with you and I am explaining to you that the meaning of the rubric abrupt is this, and in this dictionary this is the meaning, in this dictionary this is the meaning, and then suddenly someone from you says, okay, we have understood, let's go on to the remedies. This is abrupt. What is happening? Let me explain it. Let me complete what I want to complete. You are suddenly bringing the whole conversation to an end. And this may look very rude. This may look very curt. I mean, we were having a good conversation. We were talking and suddenly you interrupted. Suddenly you said nothing doing. Because maybe there are some other people who want more explanation, who are listening, who are attentive, who need more. But suddenly you have just ended it. You are not considering the others present. You are just acting out of your own whims and without reason. Just like that. There is lack of continuity. The continuity is lost. Or it is known as it's not just the words of the patient, it is also the actions of the patient. The whole attitude of the patient is what abrupt is about. Patient walks into the clinic, he sees there are 10 patients waiting, and he directly enters the doctor's cabin without letting the receptionist know, without checking whether it is his appointment or someone else's appointment. He just enters, just goes. Abrupt. Suddenly, oh, what's happening? I was seeing some patient, someone just entered like that. This is abrupt. Just out of the blue you see some action and no reason to it. Okay, we were all planning, we were all saying, okay, we will study all the rubrics of the mind, we will do this, we'll do that, but suddenly it ended one day without any reason. No, now I don't want to do. Why? I don't want to do. That is abrupt. So let us look at some of the remedies in abrupt. In Kent's repertory, there are only two remedies, that is Nat Mur and Tarentula. So Tarentula is abrupt in his action. it is like this, that I remember one patient, a small boy was brought to me by his grandmother, and the grandmother was telling me that this child does not eat food. He does not eat food at all. At all. The whole day he's running around, he's playing around, he's playing and playing and playing. He does not come home to have food. And while playing only, he will eat some mud or something and he will continue playing. So you please tell this child, no, that at least come home for 5 minutes, have your food and you go back. So I just asked this child, what happened? Why do you not come home and have food? She said, yeah, none of your business. And he just ran away from there. None of your business. So he just ended the whole conversation there. He didn't allow me to ask him anything else. End. No more questions. That is abrupt. You just end the conversation. You just break things. You just disrupt things. You don't allow the thing to continue. So I had given this patient Tarentula based on abrupt and also this desire for sand and mud. There were only 2 remedies in it, silica and Tarentula. So the common remedy in both these rubrics is Tarentula. I gave him Tarentula, the child went back home and the first thing he asked was food. Now there is another remedy that Kent gives for abrupt, that is Nitrum Mur. Why is Nitrum Mur abrupt? Nitrum Mur is abrupt because primarily Nitrum Mur is a reserved person. He is a closed person. He does not want you to know about his griefs, about his sorrows, about his griefs. Because he feels that if you know about it, then you may make fun of it or you may make light of it. You may not take it seriously enough. You may say, okay, this is not such a big grief. Why are you making this such a big thing? Okay, so because Nitrum Mur grief is also of such quality. I remember one patient, she said that she had a relationship and in that relationship, she suddenly ended that relationship one day. Why? Because they just 2 days back they had a fight, both of them, and then she said, you have to be with me, you have to understand me, etc, etc. He said, okay, we are now good. And then the next day he calls me up and he tells me that tomorrow my friends are having a party and I want to go to that party. Can I go? So she said, you decide. So he thought, okay, I can go. He went to the party and that day she said, this is the end of relationship. And she never told that person why she brought the relationship to an end. And when I asked her, why did you bring it to an end? And she said that, see, he could not even understand this much, that I should be more important to him than his friends. And what is there that I have to tell him? There's nothing there for me to tell him or explain that I should be more important to you than your friends. The fact that you even ask this question is very hurting for me. And you won't understand this. What can I talk now? I can't even talk about this issue with you. That is why I ended. So that is why Nitrum Mur is said to be completely dependent. Totally. They are completely into one relationship and one person. And they don't want any other relationship in life. Only one-to-one relationship. And that one person is the whole life. Nothing else. Nothing else other than that one person in your life. If there is one more person, that's the end of relationship. Abruptly they end it. This is the end. Why? Because you even thought of meeting someone casually and without me. You can meet. You can say, okay, we both will go to the friend's party. Okay with me. You should not go alone. There is complete and total attachment. That is why Nat Mur belongs to first column. They don't have this concept also that I and you are different in this relationship. Whatever you do, I have to do. Whatever I do, you have to do. If I say we are eating pav bhaji today, you will also eat pav bhaji. There's no question of what else will you eat. What do you want to eat? What do you like to eat? No. I like pav bhaji. You also like by default. There's no need to even ask, even tell it. If I have to ask means you don't understand. Then what is the relationship? Then where is the love? If I have to tell and then you will understand, then there's no relationship here. Then there's no understanding here. That is how Nat Mur feels. Completely one. There is no two. Everything we have to do together. As one entity, as one unit. If you even think of doing things as two separate units, that's the end. Abrupt. Attack. Or Nat Mur can also be abrupt because he or she does not want to discuss or convey this to the physician. So she will say, no, that's the end. I don't want to discuss anything more. Can you give me medicine just based on this history, or this is the end? I don't want to discuss anything more. That's it. I am ending this conversation. Because they are reserved and conserved and do not want to narrate their main issue, because they feel you will make light of it. You will not understand. That is why they want empathy and not sympathy of others. Empathize, understand my problem, the depth of the issue. Can you understand without I telling? Can you just feel my pain? If you can, then I don't need to tell you. If you cannot, then what is there to tell? No, I don't want to tell. Finish. No more history. End it. Okay. One last remedy that I would like to talk about is Platina, because Platina is also been recommended by many new authors like Dr. Sehgal very highly in this rubric, and he has also given some case examples for it. So Platina is mainly abrupt because they feel that the opposite person is not of the worth of receiving an explanation from me. You are a homeopath, you are coming to me, I am giving you an opportunity that you are taking my case. My case you are taking. So you are lucky person. Okay. So there is a lot of superiority complex. And now you question me that can you tell about this history, that history? You should know about me before coming here. You should have known who I am, what I am, how great I am. You're asking me no, they don't like to give history because they feel you are worthless. You are homeopath. I have met this oncologist, that physician, this super consultant. They have not been able to handle. What will you handle? They look down. They feel the opposite person is very inferior. And what do I tell him? What history should I give him? Yeah. Let me first test him whether he is worth it. So Platina is checking your worth or questioning other person's worth. Is that person of my standard for me to even talk to him? Yes. So that is Platina. So I hope this helps you to recognize the rubric abrupt and also the important remedies in it. Some cross references are impulsive. How do you differentiate abrupt from impulsive? That is what we will do in our next video. So this is the references I have used, and I hope this video helps you all in understanding this rubric and its remedies. Thank you.